My glasses. Lord knows I can't see without my glasses. It's 3:30 in the morning, and I have to be up in literally half an hour to start getting ready to head to the hospital. Why have I not slept? I don't necessarily feel like I'm having anxiety. I'm like I don't feel like, okay, no, let me rephrase that. I feel like I'm having anxiety. I just can't actually tell if it's actual anxiety or if it's the fact that my damn heart is beating so damn fast that I can hear it and it's keeping me up. I cannot wait to get this fucking procedure over with because I'm just over this. I'm literally over this. I can't sleep right now, and I didn't do enough today to be exhausted so that I can sleep. So it's super annoying. But yeah, I don't feel like I'm nervous about this procedure. It's not like, I mean, it's high risk, but it's not super duper high risk. It could be way worse. So I don't know, honestly. I don't feel like I have a lot on my mind. So honestly, I just feel like it's the fact that I can't, I can hear my heart beating. It's fucking irritating me right now. So, I mean, it doesn't really matter because I'm probably going to be sleeping after this procedure all day. And I still have a sticker from, it's so annoying. Let's see if I can scrub that off. There's actually no point. I'm just going to tell these motherfuckers to try to stick it back to where it was before. But yeah. So annoying. So annoying. So annoying. I'm talking low because honestly, it's 4:40 in the morning, and we have to leave here in 15 minutes. I normally, anytime I have a procedure, really anything that requires me to stay overnight, or be surgery I normally like to have my hair braided. But honestly, my mom was really tired last night, and it's 4:40 in the morning, and I'm just getting out of the shower. So to wake her up and be braid my hair is super annoying. So I'm not gonna do that. Even though for some reason, for me, there's something comforting about getting my hair braided before surgery or a major procedure. So maybe that's why I couldn't sleep last night. I mean, I didn't have Oscar last night either, which I know is super cheesy, but I don't give a fuck. I sleep with a teddy bear, and I didn't sleep with him last night because I have not washed him since Thailand. So I washed him last night. So yeah, but let me do something with this, y'all. And let me hurry the fuck up because I gotta leave soon. Come on, I got it. Let's go. Got it? No, it's on the floor.
You have so much shit in here.
Yo, you better never, ever, ever talk shit about us being dirty.
It's right there. Right. Dude, I can't even sit comfortably in this fucking thing.
First of all, she eats the steering wheel. You don't see how fucking close you are? Oh, and you gotta wind it back? Oh, shit. It's 5 o'clock in the morning and we're out.
Oh, you gave me the other one.
Yeah, as you can see, problematic. We don't know how to get it together. With traffic and shit. I don't know, y'all.
Somebody doesn't have their...
Yeah, I know. But if we stop in 2 seconds, we can get coffee, bro.
Yo.
Because my coffee's gonna last me because I have a fucking Yeti hut.
I'm telling you right now. I don't care what you...
Let's just go.
No,
It's
it literally will take me 2 fucking seconds to get everything. My coffee is the easiest to make. It's coffee and a splash of fucking hazelnut, and I'm done. I'm out of there.
Alright.
It's painful.
Okay, I don't want coffee.
I just don't understand what the big deal is about.
Okay, I get free coffee.
I know if my black ass misses this surgery, I'm going to bug the fuck out.
You're not gonna miss it.
You have to leave at
Okay.
5.
Really?
Right, and it's 5:20. And we're going to stop and get coffee.
Yes.
Okay.
We're not gonna stop and get coffee. Because I want some
That's
fucking
what happens
coffee.
when niggas is selfish. It's crazy.
It's not being... How is this being selfish, Tasha?
Joshua, like...
I'm with you, driving you to your surgery at
Joshua,
5 o'clock in the fucking
it's
morning.
5
This is not
o'clock.
selfish.
That
I
is
just
selfish
want a
if I
little
have
bit
to
of
be there
coffee.
at 6:45 and they have coffee there.
Dude, I'm gonna
You
stop
literally
and get
can't
coffee,
wait, and it
we're
takes an
still
hour
gonna
and a
make
half to get there.
it. We're still gonna make it, Tasha.
Okay.
We got this.
All right.
You can't speed. Like crazy.
All right.
Cops.
I have to be there at 6:45.
Okay.
And I'm definitely talking shit if I miss this.
Okay.
Because I missed it last time.
You're not gonna miss it this
All
time.
right.
Because now we also know how to get there.
Okay. I know how to get there last time.
I feel, me, personally, we should
At this point, it doesn't fucking matter. It's 5:20 at this point. And we're stopping to get coffee. So what are we talking about right now? Nothing matters. It's so annoying. So annoying.
I can have coffee when I get there because we gotta wait for you. So
And literally, the surgery takes a couple hours. Like, I don't understand what the problem is. There's
Because they
literally
gotta
coffee
prep you.
downstairs. Like, I don't understand.
No, they're probably gonna prep you. It's
No, the
never
actual-
at 7, actually.
The actual procedure is a couple hours.
Oh, a procedure.
No. I literally, this is my life. I literally, I missed my original surgery because we were 2 hours late.
Lower that,
So,
all the way
it's
down
great.
to the fan, just the fan. Yeah, but it gets fucking hot as fuck. I got 3 things to close.
Okay. Let's see what happens. This is my life. Should I have my friends run? So the plan changed, and we are not doing a local. We're doing full anesthesia now. So I'll be fully under because the procedure is going to be too long. It's going to be like, I don't know, between 3 and 5 hours. So since my oxygen drops down so low, they want to do full anesthesia. So fully asleep I will be. So yeah. Let's see what happens.
You're not as dark as you were the other day. And your lips, look at your lips, they're pink.
Oh yeah, my lips. Look, I got a little
Yeah.
dry. Oh shit, my lips are pinker.
Right.
Yeah.
And
I do look yellow.
And your skin looks lighter.
Now you're yellow.
It doesn't look permanent. Like
I enjoyed being darker though.
not because you can't breathe. Though.
Right.
It's not good. And it's 88. Yeah, good. You'll be better tomorrow. She'll be hop around.
All right, where do you want your jacket and your bag?
Actually, you can leave it right on that chair over there.
You just bother the nurses. That's what I'm
Um.
Let me take this menu. You don't need this tomorrow morning.
Yeah,
Tasha, can you please text me?
I will.
I'll text you too, okay?
I will.
Sleep.
Just
relax.
Actually, I was gonna say, can you just put the chair like?
Put it right over there. Yeah. Over there.
Yeah, so I could. Yeah,
So, and then put
so I could just reach it.
Yep. With your jacket and everything. That's what I would. Because there's nobody here anyway. That's your
Yeah, that's
chair.
perfect. That way, when it's time for me to get up, I could just. What do I have? Half an hour left. Oh, damn, that bag
You
heavy.
can't wait.
Yeah, yeah, you have no idea.
They should take
Just
the
the fact,
catheter out.
just the fact that he sat me up made such a difference. Like,
Yeah. When they take the catheter, now you go to the bathroom. Go to the bathroom.
yeah,
And do that. I would.
yeah. And it's my vagina feels like it's gonna fall off.
I don't know what that feels like. It's probably terrible.
Just imagine your balls falling off. It's pretty similar.
I don't want to imagine that.
It's my life.
I guess we'll be back tomorrow. I'll be
Okay.
back tomorrow.
Can you do me a favor? Can you bring this tomorrow for me? I need as much semi boxes as I can. I'll put it in my car. I'll put it in my car. Everything goes in my car.
All right.
Yo, I'm so annoying.
I got my work done. I can't touch anything.
Just like try to contact me like maybe an hour before discharge.
You sleep till 9:10 anyway, right?
Honestly, I'm thinking they're gonna let me at like probably 12. So I'll hit you up at like 10, 11 to let you
make
know.
sure.
Yeah.
I'm stealing this, bro.
Because I want to.
Is that mine? That's
Is this
mine.
yours? Is this yours?
Yeah.
She just said it's
Yeah.
hers. Like yours isn't like you bought this?
Yeah.
Oh,
But you could
motherfucker.
have it because I got that from the dollar store. I have a couple more.
No,
I'm
they
gonna steal
give
this
you
one.
little packages and stuff.
I don't think they give you that. I don't
They
think that's
do.
complimentary hand sanitizer at the fucking hospital.
They
Like,
do. They give you shampoo.
no, they do.
Mom, who's mom?
What the
On
fuck
what
is
unit
wrong?
are you staying? This
Yeah,
is not.
she's talking about a hotel, bro.
You at the Hilton.
Yeah, this is not the Hilton. All right.
Bring that shit right there.
Alright.
Catch me outside.
How about that?
Catch me outside. How about that?
I got you.
Bye, guys. I love you.
Text me too because if it's late, I might as well come. If
Okay.
he lets me leave at 1 tomorrow, which I doubt, but.
Okay. I love you.
Bye, Tosh. I love you.
Bye,
I'm
Mom.
so glad you're better.
Me
And
too.
you're light skin.
Wow. We're just going to shout out the fact that I look yellow all around. This is what we're doing right now. This is my family. They really appreciate it. Honestly, I really do notice that I really am yellow. My tan is like really like, oh my god. This is like all the tape. Don't mind this crusting. It's like the tape that they had from the mouthpiece, guys. I feel so much better, but I am in discomfort at this point because the procedure ended up getting changed. So I'm going to go over all the details of what actually happened, but I feel better. My oxygen is absolutely better. I don't know if you can see up there. Maybe I'll show you later when I can like actually get up. I am bedridden until 8 p.m. tonight. And right now it is 7:35 and I am counting down. I was laying on my back for like 8 hours, and I have like this like dip in my back to my butt that like when I lay flat it like feels like a spasm. So when I came out of anesthesia, the fucking shooting back pain that I had was so real. So the doctor was nice enough to come in the room and allow me to elevate the bed, despite the fact that I was supposed to be flat. So they ended up doing the ablation, but for some damn reason, so they go through your groin. For some reason, they did both sides, not just one. So I don't know if they had an issue with one side and not the other, but whatever. But I feel better. I am wheezing because of the general anesthesia. They like do a breathing tube, and like I guess there's like buildup from the breathing tube. So I am wheezing. So it is preventing me from being able to breathe properly. So that's all I need now. So when I came out of anesthesia, I was wheezing like that, and I was literally choking because I couldn't breathe because I was laying flat. But I feel better, and my lips really are pinker, and I really am more yellow, which is upsetting me a lot. Just saying, just appreciating my little darker complexion, you know? Guess hypoxia has its perks. Yep. Get that out. Pudding and mushroom soup and chicken and potato and game ass ice with some ginger ale. Okay, I'm about to bust it down. All right, so I'm about to bust down this soup. It's game, like legitimately. For hospital food, especially cardiac unit, anybody who's on the cardiac unit, their food, especially on Long Island, son, there's definitely a Betty working there. And unfortunately, I have to eat laying down because I have to be on bed rest. I have to lie flat because of the stitches I have in my groin until 8 o'clock. And guess what time it is right now? 8 o'clock. So I literally have to wait until somebody comes in here and tells me I can move. Otherwise, they're gonna fucking like sedate me and keep me down. Like, hold on. So yeah, all that coughing and shit is from the from like being intubated. So like it's like just like mucus buildup and shit. So now I have that lovely cough. It's delicious, isn't it? So this soup is game. Like, I'm so happy. I don't know if it's because I haven't eaten since yesterday. It's like my first meal. But this is actually really good. And it's seasoned. That's really what it is. Because, again, back in that, I must say, in all the years that I've gone and been and stayed in the hospital, the food has definitely gotten better, because at one point it really sucked ass and was disgusting.
This is so cool.
So
Really
hold on, my nurses are in, so hopefully they're gonna free me of my jail cell right now.
In just a little bit.
In just a little. All right, so they're done. They told me I could sit up more, so I'm hyped. And then I have to go for my first walk, just to make sure no stitches pop out and I don't start bleeding again. Game. Like, legitimately game. So I was saying that the history of hospital food has definitely gotten better. At one point, I mean, like, I've been in the hospital my whole life, so I've definitely been able to see the progression of it. I'm a little swollen still, like from water retention, but whatever. Back in the day, it was disgusting. Like, it was like horrible. Like, literally, you'd want to kill yourself. It was so bad. And now it's not so bad. Like, they're actually putting seasonings, and like, it's not horrific. It's not great, but it's definitely not horrific. So that was like rosemary and herb chicken, and rosemary potatoes with a mushroom soup. And then I got a little rice pudding, and I was like, girl, just in case the rice pudding is nasty, let me get a chocolate. But I didn't know it's Cozy Shack. So, you know, both of these are about to be lit. So I'm about to tear all this up. But I'm so glad the food is not nasty. City food, I'll tell you this. It's like restaurants, honestly. Like, you know how, like, on Long Island, like the food is good. I'm not gonna talk smack about Long Island because it definitely has good food, but the city always has better. And it's absolutely the same concept hospital-wise. The hospitals that are in Long Island, their food is like Stony Brook mostly, because Mather's okay, and I've never really had I've never been to St. Charles, so with that, they're like good, but definitely not like this. They got a whole Caribbean cook, and let me tell you something, grateful. This cough is so annoying. I hope it goes away. Like, the side effects of all the things you do. Oh, I'm over here shaking the thing. Shaking a little dry. But you know, look, when you ain't eat all day, you be ready to eat anything. Okay, maybe not anything, but a lot of things, you know? Alright, so I'm gonna eat this, and I'm gonna come back to y'all and tell you what happened for the surgery, okay? So, guys, right now, the nurse is going to take out my Foley. So, a Foley is literally a device that helps you urinate when you are put under. And it's literally I think it's put in your pee hole, right? Or is it in your... Yeah, so she's about to yank this. Oh, I hate that sensation. So she's going to pull it out right now. And it's very uncomfortable. It's probably one of my least... honestly, all this is unfavorable. I was like, can I just be weird? I'm going to record this. Not you, just me.
1, 2, 3.
Oh.
We're done.
All right.
Would you recommend me?
Yeah, that was not as bad as I've had in the past.
Very good. You did great. Deep breaths.
Thank you.
And I can sit back up.
So now it's time for us to walk, because to make sure, I'm gonna assume just to make sure that this doesn't open up. So yeah. The shit you have to go through when you're a congenital patient is annoying.
No.
It's like,
All right. We'll
all right.
around.
Oh.
I'm gonna hold this for you.
No, it's okay. I got it.
Got it.
I just have
Deep
to.
breaths. You're just gonna sit on the edge first.
Just trying to regain my
Yep. Take your breath.
my breathing.
It's been a while since you walked.
Yeah. It's funny because, like, no matter how much you know how to walk, it's like when you've been down for a while, and it wasn't even that long, it feels weird to, like,
To get back into
to sit back up, yeah.
Right. Totally. Put this hypoplatic around here. So it moves it.
Thank you.
Good.
Oh. All right, guys.
You got this. No rush. You want to sit for a while?
Yeah, just a little bit.
Let's do that.
just because I want to get my,
Just don't get up without me. I'll be back in like 10 minutes. You want to sit on the side?
No, 5 is
5
good.
minutes?
5's
Okay.
good.
Sounds good, dear. All right, get some breaths.
Thank you. To regain my composure. Like kind of shaky a little bit from having laid down all day. So it's a little bit of a struggle. That calf was not the worst because normally when they pull it out, that shit, it's just like, it's weird. It's like having a snake crawl up into your clit and then somebody snatching it out. That's what it feels like. I think what's making it weird is the fact that I have this like weird like oh, that's nice to get out. Weird like wheezing. So like I feel a little shaky. It's crazy. Oh, dear God. Yo, the struggle of having a congenital heart disease is so real because the reality is, I was telling the nurse, for the most part of my life, I hid my disease from the majority of people. I don't think I became as verbal as I am now until really like in my 30s. And really, I started becoming more verbal about it when I needed my valve replacement, because at that point I couldn't hide it anymore. But the sucky part is when you don't look sick, it's difficult for people to understand that you're definitely having an off day, or that you are not fat just because you're fat. It's because you spent your entire life thinking you couldn't do certain things, or do physical activities and so on and so forth. I mean, let's be realistic. The fat don't help. Okay, I'm supposed to be skinny, but I've never been skinny. So, I digress. You know what I'm saying? But yeah, so it's difficult to have people understand why you are the way you are when you don't look a certain type of way. It's easy for people to understand you being handicapped when you're missing a limb or you're in a wheelchair. But when you look like how I look and you do the things that I do, when I tell people that I have limitations or I can't do that or I'm just really tired, I definitely sometimes feel that hesitation, like, you sure you're not being lazy, bitch? You know what I mean? And sometimes I'm just genuinely just listening to my body, and that is really what has gotten me as far as it has gotten me in comparison to other congenital heart patients. Yo, I look and feel as good as I do because I listen to my warning signs. I don't push myself past certain things. I do crazy stuff, but my body tells me no, I listen. So after this whole valve replacement, that warning sign is a little harder to recognize, I'm finding. So the things that I would normally listen to, I'm finding I'm having to tweak because they're not there anymore. So I'm having to relearn my body and relearn certain warning signs and my new ones, I guess. You know what I mean? So feel better. Sitting up feels better. You know what I mean? I'm ready. Look, we gotta get to walking because that bitch is trying to go home. Okay? Trying to go home.